team, of course, with expertise in research and innovation. So for today's topic, we would like to delve into applied research with our theme right there. I think if I start with a brief applied kind of a research experience that I've had, I personally participated in a research. You could perhaps Google it. It's called SMARTER research, where in Mbale Regional Referral, where we're training the carers of patients, or you could call them as caretakers of patients. We're training them how to take vital signs, to take blood pressure, to take temperature, to take pulse rate. And this all came about as a result that when you look at the health system, the health systems currently and the limited human resource, the nurses and the midwives on ward vis-a-vis the number of patients, the ratio is quite huge. So this kind of intervention was put to see how best the carers could assist the nurses in the recognition of these perhaps early signs for complications. And the aim of this kind of a project was like, if these signs of complications are identified early through these vital signs that are being taken, perhaps, and the carers notify the nurse or the midwife on the ward, perhaps there could be an early intervention that could actually rescue these patients from developing severe complications. So that is one of the researches that I can give you as an example of an applied research. And that's kind of research that we want to delve into right about now. So key points into the introduction of applied research. It is conducted specifically to solve real-world problems. I've given you one of the problems that was being solved, okay? Limited human resource. That is nurses vis-a-vis the number of patients, the ratio being high. And at the same time, unlikely with basic research that you usually do for academia, applied research's goal is practical application rather than developing theories and then giving knowledge. However, I still apply basic research could still complement complement the development of applied research or practical research, and it is quite used or applied in healthcare, policymaking, business, social sciences, and so many other fields in agriculture. If you look at the image on the right hand, that is on the right hand of this screen that I'm using, you can see a gentleman right there with a pump of two pumps in one. The pump that has water and another with liquid nitrogen. You very well know that nitrogen is essential for is very essential for plant growth and productivity. And so you could see that these pumps were joined together to actually hydrate the plants, that is, irrigate the plants, at the same time provide nitrogen. So kind of an intervention is really applied research. So how can this work? Is it feasible? Is it applicable? That is really the reason, the core for applied research, not just development of knowledge and theories. Applied research is systematic and methodological. You have to really have smart and systematic methodologies. And it, as I communicated earlier, it is actually used to address issues, problems within the society. However, it is directly linked to decision making and problem solving. However, it is actually not a, can you perhaps mute somebody who is speaking, Alex? Okay, sorry for that inconvenience. However, applied research does not really focus on theory, abstract knowledge, and it's not purely academic, and also it is not really detached from real world needs, as I told you earlier. If you look at the right hand, you can see those images. The upper one where someone is studying the trends of disease. Indeed, this is just basic research. You're trying to understand the diseases, the patterns of disease. And when you look at the second image, perhaps maybe a healthcare worker is trying to talk, to counsel, to perhaps perform counseling using an image. So she's actually trying to assess whether counseling with an image could actually enhance knowledge and understanding. So this is applied research. Usually the funders usually like applied research as opposed to basic research that just provides knowledge. So in perhaps those that work with organizations that develop proposals for funding, you would look at majorly focus on applied research innovations as opposed to basic innovations that just yield knowledge. So the key differences between applied research and basic research are also discussed here on this other slide, where the purpose is quite different. Here we are solving specific problems in applied research. As for basic research, you're just expanding fundamental knowledge, or you're developing knowledge. The setting in the applied research is indeed real world. You're addressing issues that are really existing. As for applied research, it could be academic, and then you're in the laboratory trying to mix these kind of reagents and samples and seeing results. And for applied research, most of the time is short term, because you want to actually put away this problem. You want to provide a solution to this problem. If it is really taking long and this problem is fatal, that means you'll have lots of deaths registered before you actually implement the solution. I can give you an example of COVID-19 vaccine. That was applied research, development of such a vaccine. It was really short term. In less than a year, we had the vaccine on board, and people were getting vaccinated. And usually the outcome are really practical recommendations and solutions and policies, as opposed to basic research where you have theories and models and principles. So applied research is really important, that it helps in policy making and evidence-based decisions making. As you differ from basic research, for applied research, we actually base on evidence, what worked elsewhere that we can also use, or we can relate or adapt to our setting, and will it really work? So you assess the efficiency, the effectiveness of such an intervention, and also it improves service. On my right, you can see the image that I put there. Instead of you opening the tap for hand washing and all that, there is an improvision of a step-on tap where you just step on, you just like don't open. So such innovations are really applied research, and it has adaptation. Actually, it's one of the important. It is adaptable to technology, existing technology, and some of the characteristics of applied research, it is valid. That means its products and produces are accurate and credible. Okay, and at the same time, it is one of the other characteristics. It is effectiveness. it meets intended goals, and it is also reliable. That means that if I happen to do the similar applied research in the similar setting, I can actually yield similar results. And at the same time, the fourth point or characteristics, it is also relevant or relevancy, which actually means that it aligns with real world needs. You don't come to Uganda, you don't come to Africa, and then you want perhaps to implement most of our diseases currently. Cancer is also elevating, but give an example here, we don't have dengue. I'm giving an example of Uganda. We don't have dengue fever. And in Indonesia, I can pick reference from Miss Salma, who has been there. They actually, Indonesia, they rarely suffer. You rarely get cases of malaria. However, there are so many cases of dengue in Indonesia. So doing a research that addresses dengue in Uganda, that research is not relevant because it's not addressing the real world needs, the needs of our society. In a similar fashion, when you go to Indonesia and then you want to perhaps apply a research that is dealing or is trying to alleviate malaria, still it's not relevant in that setting because they actually rarely get cases of malaria. So applied research, the other characteristic is very feasible, or the feasibility of that research. Indeed, it is practical, achievable within the given constraints, within the available resources. And these are the five-step framework for applied research, where you start with clearly elaborating more or elucidating about the issue, the problem. What is the problem? What are the goals? And thereafter, you scan existing information. What information do you have at hand? Can you magnify? Are you able to provide evidence of this existing problem? Or if it's an intervention, could you provide evidence that it has worked elsewhere? Okay, and then plan your research and tasks and methods. And as I told you earlier on, applied research is really methodological and systematic. So the methods really need to be very smart to actually achieve the intended goals. Thereafter, collection of data, analysis and interpretation, and thereafter the analysis, making meanings out of this data, making sense, and perhaps developing interventions or recommendations. Then the last step is you need to share, you need to intervene, you need to revise, you need to share with the different stakeholders to see that they can actually work on the issues that way based on your recommendations. So how applied research informs practice? As I told you earlier on, applied research, indeed from the word application, do research, action research, it actually informs practice and policies in this manner. It provides empirical evidence for policy making. It actually provides evidence-based results onto which you can base on to actually improve different operations and interventions. It is used to tailor products and services in market research. And on the other side, I gave a flow, a process where you actually have a policy question and then observations of maybe it could be an intervention, or if you need to do some modeling, you need to adapt this, you need to have some changes, and then you see whether the answers actually are real world or they answer the problem that you assessed. However, there are also challenges as that could actually fit pitfalls or dim fit of applied research. Give an example of if you actually did not define well your research objectives, you could not actually have the genuine, realistic, and reliable results that could actually inform interventions and recommendations to different stakeholders. Biased data collection, if you don't have very nice, genuine, and valid data collection tools, you may actually not have very genuine results that could inform your applied research. So in so doing, you need to really have multiple data sources and methods. At the same time, the other challenge is misalignment with stakeholder needs. You really need to develop an applied research that is relevant to the needs of the society. And at the same time, you need to really take time. It shouldn't be developed in a rush so that you could have better results that could inform practice. So in summary, applied research is very essential to solving real-world problems. It is different from the basic research, that academic research that you've done before in high school, in colleges, at the universities. And at the same time, the other take-home is that there should high quality applied research follows structured methodologies. I've talked that earlier on, that you need to really select nice, smart methodologies, perhaps used elsewhere and they resulted into good results. That means they are valid. They have been tested elsewhere to be fit to yield good results. And at the same time, it plays a crucial role in policy development and organizational decision making. Results of applied research, like the research I told you earlier on of SMARTA that I participated in as a research assistant, and the PI was Dr. Smith Adam of Mbale Regional Referral, for those that know Mbale Regional Referral Hospital. Such a research was really informed, was to provide evidence that actually carers or caretakers can actually help these nurses that are overwhelmed on ward to actually take baseline vital signs. So such research transforms impact. It brings about evidence. It actually brings about good practice. It bridges the gap between knowledge and action. So this is my last slide, unless otherwise, but I thank you all for your time today and appreciate you adjusting to meet this time frame, which is quite late in the evening of the day. And at this time, I could accept in 1, 2, 3 questions from you, and then we see how we wrap it up. Thank you so much.